Ding, ding, ding. Ding, ding, ding. Class is in session. Get in here. Get in here with your paper and pencil, your pad and silent. Today we will be breaking down the nursing process as it relates to pharmacology. But before we start, let me introduce myself. They call me Miss Rose. And if you are new to the channel, welcome. Thank you for supporting this channel, and I hope you find value. If you've been here before, thank you again for your continued support. Let's get to it. The nursing process, why it's important. Okay, as nurses, we follow a clear process when taking care of people. This process has five important parts. First, we assess the patient. We look at their health and gather information. Then we make a nursing diagnosis. We identify the health issues that nurses can address. Now, this is important because sometimes nurses want to identify problems that the physician can address. Okay, so he has his problems and we have our problems. So let's try to stay in our lane and identify those health issues that we are licensed to address. Next, we plan the care. We decide what actions we need to take. And I'm gonna give you an example. So suppose they're having difficulty breathing, right? Maybe they're having some shortness of breath, difficulty breathing. Well, of course, we can administer the medications as ordered, correct? Okay, very good. However, we can also elevate the head of the bed. We can also get a pulse ox, right? Okay, we can also teach them some deep breathing techniques and how to bring up sputum. We can do that. Okay. And we don't need any medications to make that happen. These are things that we can take care of, that we have a license to address. Okay. Now, after we plan the care, which would be our actions, we implement the plan. That means we carry out the nursing actions. Finally, the last part, we evaluate and record. Okay. So we have to make sure that elevating the head of the bed, teaching them how to deep breathe and cough and um, remove the sputum helped. Did it help? Did it make matters worse? We have to evaluate that, and then we have to record. So we see if the care helped. We see if the care helped, and we write down the results. Okay, we write down the results. Now, how does the nursing process relate to pharmacology? That's what we're talking about today. So how does all of this assessment, nursing diagnosis, planning, how does this relate to pharmacology? Okay, so let's talk about it. How many different methods are there for collecting the patient information? Does anybody remember? And why are we doing this? So if I say primary patient information may be unreliable, where or who am I collecting this information from? Primary. The patient, correct. The patient is the primary source. So where do secondary sources come from? The patient's family. Very good. What about tertiary sources? Where do we get that? That could be um, medical record, right? Tertiary source information may not apply to all patients' needs, right? So maybe this is their first visit. They don't have a medical record. There won't be a tertiary source. So we have three reasons for obtaining a drug history. One is to evaluate the need for medication. One is to obtain current and past use of over-the-counter medication. We want to know, we need to know that because there could be some interaction with what's being prescribed. And we need to identify problems related to drug therapy. Um, is there going to be a problem swallowing this medication? Is there going to be a problem with self self administering this medication. Maybe they don't like needles. They're not able to give themselves a shot. So we need to identify any problems. Okay. All right. Now we have this nursing diagnosis and pharmacology, right? The nursing diagnosis and we just did assessment. We remember it's 5 parts. So nursing diagnoses can frequently be developed from the patient's medication regimen. Okay. Um, they are typically linked to drug treatments for specific conditions or the side effects of medications. So if we know, just an example, if we know that this drug may cause dizziness or drowsiness, I think I got a diagnosis right there, right? Um, diagnosis can be risk for injury, right? Because of the dizziness or the drowsiness that this drug may cause. Additionally, they may arise from pathophysiologic changes due to drug interactions. So sometimes there is interactions with food, sometimes there are interactions with other drugs, and sometimes those interactions can be fatal. So we really need to um, be paying attention to when we get the history, when we do the assessment of what they're actually taking. We also examine drug monographs. This would be like your drug card or your drug book, wherever you get your information about your drugs, to pinpoint issues connected to medication therapy. All right. So remember the nursing diagnosis differs from the medical diagnosis because the nursing diagnosis indicates a human response pattern that the nurse is licensed to treat, whether you're PN or RN. The medical diagnosis indicates a medical condition. The nursing diagnosis determines what the nursing interventions will be based on defining characteristics gathered from the assessment. The defining characteristics support an actual nursing diagnosis because these are the signs and symptoms that indicate the diagnosis. Okay, they prove your diagnosis. Now, in the example, I said risk for injury. There are no defining characteristics in a risk for injury diagnosis. You know why? Because it's only a risk, it's not an actual problem. So there are no defining characteristics. But if the diagnosis was, um, um, say, impaired um, mobility, say impaired mobility, that would put them at a risk for injury, right? So say it's impaired mobility, then I will have defining characteristics. And defining characteristics are indicated by the words as evidenced by. And then you list the signs or symptoms as evidenced by unsteady gait, right? They're not steady on their feet, or as evidenced by dizziness from the medication. Okay, so that it gets put them at impaired mobility. Okay, let's keep going. Okay, now when we look at the 5 types of nursing diagnoses, the most common that you'll probably be using is the actual. This is based on human response and supported by defining characteristics. So the nursing diagnosis determines what the nursing interventions will be based on defining characteristics gathered from the assessment. Okay? Defining characteristics support an actual nursing diagnoses with signs and symptoms that indicate the diagnosis. So if we start over here, right here, this is number 1. This is the actual diagnosis. All right. So this could be impaired gas exchange. What is the human response? How do you know? As related to, right? Because this actual diagnosis has 3 parts. So impaired gas exchange. Let's write that down. Impaired gas exchange. For you people that are new to the channel, I like to write on the board. Okay, impaired gas exchange related to, so this is the first part. This is the second part. Related to what? Related to, um, I don't want to say COPD because that's a medical diagnosis. So let's say related to inflammation of airway. Okay. And then number three would be as evidence by, and you can put, they can have a non-productive cough, non-productive, and I like to write in cursive, non-productive cough. And you could put O2 sat, 87%. Okay. All right. That's the impaired gas exchange. Oxygen is a gas and it's 97%. That's too low. Okay. So it's three parts to actual um, nursing diagnosis. Then you can have a risk for or high risk diagnosis. This one will only have two parts, right? The only part this one is missing is this, as evidenced by. There's no number three for the risk because it's just a risk. It didn't really happen yet, so they don't have signs and symptoms. So we can have them for risk for impaired gas exchange related to the inflammation of the airways, but there's no as evidenced by. Okay, the other one, that would be number two. The other nursing diagnoses, number three, is the possible suspected problems requiring additional data. So there could be a possible um, impaired gas exchange or a possible inadequate, ineffective breathing pattern. But we need to get some more data to see about that. Okay. In my nursing career, and I've been nursing since 1997. We don't use this one that much. This one hardly really ever gets used. It's usually this one over here. The next one is the wellness diagnosis. The wellness diagnosis is a good one. We don't use it that much either, but it's a good one because it's a clinical judgment that you make about a transition from one level to a higher level. So we'll take a couple examples. A patient is new diabetic and they have to learn how to give themselves injections. Well, they're not ready to do that yet. So we can't give them this wellness diagnosis because they're not ready to move from learning about the diagnosis to treating the diagnosis. Okay. Another example is a patient who has an amputee, right? He had an amputee below the knee, and we want to try to teach him how to, teach him stump care, how to care for his stump. Well, he doesn't even want to look at it. So he wouldn't get the wellness diagnosis because he's not ready to move from having the surgery to caring for the stump. Okay, so that's number four. And then the last diagnosis up here is the syndrome. Syndrome clusters signs and symptoms to predict certain circumstances or events. Okay, a good example for the syndrome would be, say, um, chronic pain syndrome. How about that one? Chronic pain syndrome related to neuropathy. Okay. Secondary to what? If it's a neuropathy, what would be secondary to? Yeah, well, probably diabetic. Now, this one gets it as evidence by reports of or verbalizes pain. Okay. So those are the five diagnoses. Let's move on to the next slide. Okay, the next part of the nursing process is planning. So when you're giving medication, remember these three steps. Find out what the medicine is for and what problems or side effects it might cause. Okay? So you want to identify the therapeutic intent and common and serious adverse effects. We want to double check the right amount and the way to give the medication, right? So we need to confirm recommended dosage and the route of the medication. How are we to give this? Route means how do we give it? IV, sub-Q, IM, PO, transdermal, intradermal, intrathecal. How do we give this medication? That is the route. We need to check that scheduling and administration of medication is based on the provider's orders, right? Okay, so we got to follow doctor's orders for when to give this medication. We can't give it when we feel like it, and they can't get it when they feel like it. We got to give it as prescribed. Now, if giving it as prescribed is going to cause some issues with our patient, then we need to talk that over between them, us, and the pharmacy and the doctor to see if it's okay for us to give this medication later. They don't like to get up early in the morning to take it. Can we give it after breakfast? We can work with our patients, right? It doesn't have to be, we don't have to be that dogmatic about it. But we do need to give it as prescribed because if not, then it's a medication error. Okay? Teaching patients. We need to explain the medicine to the patient, right? What are they going to be getting? Write down when you gave the medication and how the patient reacted. That's our evaluation. If needed, we can show the patient how to take the medicine on their own. We need to tell the patient how to store their medicine and when to get more. Okay? That's the refill. They may need to refill this. Um, let's see. So when you are documenting, because you have to document the patient's response, right? This is what you need to include. You need to include the drug name, the dosage, the route, the time of administration, all adverse effects, dosages missed, and the reason it was missed. Okay? All right. So that's important. What did you give? How did you give it? How much did you give? What time did you give it? Were there any adverse effects? Did you miss the dose? And the reason you missed the dose. All right? That's what should be included in the record. Very good. Now, interventions and implementation. Remember, interventions is based on that plan. So you remember, if you don't remember, you better go back and read it in your textbook. It should be in your fundamentals book. The nurse must remember the 7 rights of drug administration. Some books have 5 rights, some books have 6 rights, some have 7 rights, some have 11 rights. So, but there's basically really only like 5 that you need to know. Okay, and that is the right patient, the right dosage, the right drug, the right time, the right route. They've added the right uh reason, like why are you giving this medication? It needs to be for the right reason. Okay. So but those are the basics, 5 basics, but they've added some more as the years have gone by. So nurses prepare the prescribed medications using procedures to ensure patient safety. And knowing those rights, however many is in your book, because that's what you'll be tested on, is ensuring patient safety. Select the correct supplies. Do you need syringes? Do you need a cup? Do you need the plastic cup or the paper cup? Okay, is it a liquid or is it a pill? If it's a liquid, you need the plastic cup. If it's a pill, you can get away with the paper cup. Verify all aspects before preparation. And there's also 5 checks, right? You're supposed to check these medications. I believe it's 5 checks. You're supposed to check it before you even get to the patient's bedside, and then you check it again when you get to the bedside. Um, Collect appropriate data to serve as baseline for later assessments. And what we're talking about here, let's break this down. The appropriate data could be a pulse, apical pulse. Maybe you're supposed to check the apical pulse before you give this medication. Maybe you're supposed to check the blood pressure before you give this medication. Okay? So collect the appropriate data to serve as a baseline for later assessments. Administer medication by the correct route. Document all aspects of administration. Okay? Everything. Whatever you did, document it. Implement actions to minimize expected side effects. Excuse me, I have to sneeze. Okay, sorry about that. What was I saying? Oh, implement actions to minimize expected side effects. So if expected side effect is GI upset, then you may want to administer it on a empty stomach or with food. So it depends. If this medication is best with on an empty stomach, then to minimize the side effects, you're supposed to give it on an empty stomach. Um, and some you're supposed to have something on your stomach. So if you need to administer with a full glass of water to minimize some of the effects, then make sure you're giving a full glass of water. So educate the patient as appropriate. So that if they have any questions about the medication or if there's something about the medication you think they should know, you need to educate them on that. Like they should not get out the bed after you give them this medication. Here's the call light, press it if you need me, you know, things like that. All right, now evaluating. Evaluating therapeutic outcomes is the last step of the nursing process. Evaluation. Evaluation procedure for determining therapeutic outcomes of drug therapy include assessing patient responses to the medications. If you gave them a medication for pain, did you go back and evaluate the medication to see if it took care of the pain? If they told you the pain was a 10, I think you should go back at least what in half an hour to see if the pain man is working. It should be down to about a 5. Can we get it down to a 5? Did it go from a 10 to a 6? You need to assess their response. Determine signs and symptoms of recurring illnesses. Determining signs and symptoms of recurring illnesses. So you need to be um, um, diligent, proactive, right? Maybe medicating them before uh, those signs and symptoms come back up. Assessing for any adverse effects. Did they break out in hives when you gave them the medication? Did they have any trouble breathing after you gave them the medication? You need to be assessing for any adverse effects. And don't tell the CNA to let me know if they break out in hives or if they have any trouble breathing. I just gave them some medication. Okay, so now you're asking the CNA to do an assessment? No, they don't do assessments. That's the nurse. Make sure you're doing the assessments. Determining the patient's ability to receive education and self-administer medication, as well as the uh, potential for compliance. All right. So, is there a potential that they may not take this medication? Is there a potential for non-compliance? Um, Determining the patient's ability to receive education and self-administer. What type of diagnosis was that? We talked about it. What type of diagnosis was that? That would be the wellness diagnosis, right? That would be the wellness diagnosis. Are they ready? If not, then we gotta wait because we can't make them if they're not ready. We cannot make them. Okie dokie. Let's see. Okay. I think that's it. So, hey, thank you for watching the channel. If you like content, please hit the like button. And to be sure you don't miss any new content, go ahead and subscribe. And feel free to share this with your study buddy in your study group. I'm your study buddy. I'm here for you. There's no products, no merch, just me breaking it down. See you at the next lesson.